When you look at ADA guidelines, they recommend anybody over 10% A1C should initiate insulin therapy. I don't think that really happens in the real world. There are a lot of issues around insulin, things that come up between the physician and the patient, I think that limit the use of insulin. But when you also look at number of patients who are on multiple oral therapies, whether they're on 2 or 3, ideally you would think that they would be candidates for insulin because they're not getting enough subsequent A1C reduction as they add on additional orals. So the proportion of patients that would require insulin, my perception is probably on the higher end. We just don't see that in the real world because of the issues and stigmas associated with the use of insulin. Use of insulin has always been an issue with patients because they think that once they have to go to insulin, that their disease is worse than they thought. They don't want to understand or comprehend that they have a severe disease. That's one issue, and I think that's probably the main one. Use of insulins is the needles is another concern. Patients just don't want to self-inject. These patients are on potentially a basal mealtime, is 3-4 shots a day. They just can't. They can't handle the number of injections. The other things are obviously the issues associated with insulin themselves in terms of side effects. So they are notoriously associated with weight gain and high rates of hypoglycemia. So the hypoglycemia, obviously if it's severe or life-threatening, would require medical intervention. So that's additional cost in sort of managing those patients, additional difficulty in managing those patients. And the weight gain is obviously, these patients are already overweight to begin with, and ADA has always had a policy in place in terms of addressing weight reduction, and that would be counterintuitive to treating somebody. Yes, you're lowering the A1C, but if you're causing that patient to gain weight, then you're also may be actually contributing to some of the symptoms of the diabetes and some of the comorbidities that are associated with it.